Hello everyone, welcome to Digital Health News and yet another episode of DHN CXO podcast. Well, today's topic is diagnostic. Diagnostics is no longer just about reports and reference ranges. Today it's about scales with precision, science with speed, and trust at the last mile. As healthcare moves closer to the consumer, the real question is this: how do you transform a legacy diagnostic brand into a digitally fluent, consumer first, AI enabled healthcare platform without losing the clinical rigor? That's exactly what today's conversation is about. And I'm joined by Mr. Surendran Chemmenkotil, Managing Director at Metropolis Healthcare Limited. With over 3 decades of leadership across office automation, telecom, and now in healthcare, Mr. Surendran has led some of the most complex transformation across geographies and industries, from building large-scale networks at Airtel Africa for steering customer-centric growth at Bharti Airtel and Xerox. His career has consistently sat at the intersection of execution and reinvention. At Metropolis, he's driving what he calls Metropolis 3.0, a transformation focused on expanding into Tier 2 and Tier 3 markets, strengthening leadership depth, accelerating D2C growth, and embedding artificial intelligence across diagnostics, operations, and customer engagement. It's a shift that blends scientific excellence with platform thinking and scale with sensitivity. In this conversation today, we will explore how diagnostics is evolving in India, what it takes to lead transformation across sectors, and how Metropolis is reimagining its role in a rapidly changing healthcare ecosystem. Let's dive in today's episode. Thank you so much, sir, for joining us and welcome to DHN.
Hello, Aarti, and thank you very much for having me on your show. It's always been pleasure to interact with you and the audience. Yeah.
Let's start with the first question. India's healthcare system is still largely reactive. From your vantage point as a diagnostics leader, where exactly does the system break down, say, between the first symptom and first diagnosis? And how can diagnostics fundamentally change that equation with the patients?
See, in India, often the healthcare system, starts its action when someone gets into severe illness,
Yes.
and the diagnosis come much later after the illness is happening, and then more of a, reactive approach. Um, the reasons for that is multiple. One, of course, is the awareness about being diagnosed better and earlier, and of course, at times, affordability, and also access in cases, let's say, into tier three and beyond towns. So the system breakdowns actually because once you get sick and you go to the hospital, and then the whole process starts. And as long as one is able to do the diagnosis ahead of time and keeping diagnostics as one of the early initiatives in this whole process, the systems can get much better. So some quality testing integrated with primary can enable faster decisions and preventive interventions. Diagnostic in Metropolis, we believe that diagnostic should act as a foundation of proactive healthcare, not just a confirmation tool.
Thank you so much for that information, sir. Let's move on to the next question. We have all seen diagnostics evolve from a back-end service to a strategic pillar of healthcare. What moments in your leadership journey reshaped how you personally view diagnostics as a driver of prevention rather than just detection?
See, I came into healthcare from a different industry, and the beginning, I thought, diagnostics also a lot more of a back-end function, back-end service, something that supports the treatment when people are sick. But after coming into this space, I could, looking at the scale of tests that's been done and the amount of the list of tests that we have in the industry, I just really was mind-boggling. It really, give me a reminder that diagnostics is not only about getting used only when you are sick, but I think the amount of data available with us, the amount of preventive screening that can happen, really will able to identify the chronic risk and early diseases, etc. And as the system appeared, and if you do the proper diagnosis, the outcome can be much better and much sharper. So the my own personal learning when I've joined this company, the amount of data available in the industry, in the company, clearly gave me the indication saying that, okay, well, preventive health is always better, and diagnostic can play a very important role in the preventive health care. And in fact, you would have all, I mean, all of us would have been learned during this COVID period. COVID, was in diagnosis was the first line of defense, right?
Yes.
And actually, many of us in the country, actually had real time clinical and public health decisions were being taken on the basis of diagnosis. So some of these instances really gave me the reminder that actually diagnosis is the driver of prevention rather than just detection of the disease.
So just as you mentioned about COVID, I think one of the point that COVID also taught us is the importance of data in healthcare. Uh, and I just want to touch base on the Metropolis 3.0 that you have also mentioned. Metropolis has grown across geographies, volumes, and specialties. At what point did the organization consciously shift from being a testing company to becoming a data and insight led healthcare organizations? I believe the Metropolis 3.0 revamp is completely focused on data, on artificial intelligence, and also expanding to geographies, say tier 2 and tier 3 towns and cities across India. So, could you shed some light on that aspect?
See, Metropolis actually scaled across geographies and across test volume. And when we do this, when we in this journey, we realize that the diagnostic data, when you interpret in the clinical context, could drive early intervention. Personalized treatment and preventive care are a very big, population at scale basis. So I mean, when you have this data, when you have this pattern, individual patient pattern, geography patterns, disease-like patterns, and specialized areas, and when we could see this whole amount of data, I mean, then, it was very, I mean, easy, very clear that strategic investments in the digital platforms and advanced analytics will really help in the specialized diagnosis domains, and our shift from transactional testing has then moved into, a data-based, insight generation, right? And some of these things, and I think, I mean, not now, I think many years before, and actually we have began this journey. And over a period of time, you could also see that diagnostics then evolved into strategic healthcare partner focused on improving outcomes, enabling, prevention, and not just delivering reports. So, I mean, the amount of data available in the healthcare system is today humongous, and if it is used well, a whole lot of disease can be cured much earlier than later once the disease comes, and then you start worrying about it. And also, early detection and prevention will also come. If you could do that, it will come at a much lower expenditure that you do it today. So I think these are some of the moments of truth, if you ask me.
But sir, given that data is now all pervasive, you just mentioned about how data has been become important, especially in diagnostic. But that also sort of creates an information overload. And data, when you talk about it, is also very important to put it into the context. That is helpful for not only the clinician but also for the patient. Now, you at Metropolis process millions of test results each year. How do you turn this scale of diagnostic data into, say, early risk indicators for patients and clinicians without sort of creating that information overload for them?
Yeah, so I think there is a whole lot of data and a whole lot of raw data, at this point of time in the industry. But I think what we need to do is the raw data has to be converted into some clinically meaningful signals. I mean, for example, in our reports, you could see there a trend analysis,
Yes.
So it's not only about that particular episode when you fall sick, that particular disease. At that point of time, you don't get your reports. But, last 1 year, 2 years, whenever you did that particular test, you get a, trends of your disease, and things like that will help us, in the risk stratification and contextual medical interpretation, right? I think some of these things is very important, and as far as the clinicians are concerned, they need very clear data. They don't want complexity. And for us, Metropolis, what we do is, and all the in when your data, when your report has been sent to a clinician, we just highlight the exceptions,
Hmm.
and also the medical significance of those
Hmm.
exceptions, and it becomes easier for the clinician to then read it and then use it to make easy decisions as far as is patient diagnosis is concerned. So at the same time, what is more important when you are converting this raw data into clinically meaningful information, you need to have very high levels of quality controls. You need to have very high levels of governance. And then only the clinical relevance can ensure data creates foresight and better decision rather than information overload.
Let's come to the major talk of the town, which is artificial intelligence. I believe for the last 2 years, one of the technologies that has the maximum potential, and across the globe, people also agree that this is a technology that has the potential to completely transform healthcare is artificial intelligence, and its impact in diagnostic has been massive over the last 2 years. We have seen so many startups coming up in this space, specifically promising to improve the diagnostic accuracy and also the turnaround time. Now, I would like to know what you at Metropolis are, doing in terms of artificial intelligence, incorporating AI into your diagnostic ecosystem, and where do you believe the human clinical judgment must remain irreplaceable?
See, there is a lot of talks about AI, and in almost every areas of work today, AI is really making its mark. When it comes to the healthcare, one need to go a little more careful because at the end of the day, you are dealing with the lives of
Right.
people, right? And hence, rather than using AI as a fancy, what you call heading, we just want to make it a little more responsibly. So that's the first and most important things when it comes to the healthcare. So, but having said that, very carefully, in we have been trying to use AI in certain domains for sure. For example, we have used AI in improving the turnaround time
Hmm.
by improving the workflows in our laboratories, for example, and we have also done a whole lot of data available with us. We can do some auto validation on some of the using AI in some of the data, and then can what you call highlight the exceptions, which then the doctor can actually interpret it and maybe use it for his diagnosis. So we have done some level of things like that. But at the end of the day, I mean, if you ask me, it's little early stages when it comes to AI in the healthcare industry. And also, you must remember the amount of data available today is not so much to do the about the Indian population. So it may take a while more to get the right information, insights about the Indian population related health information. But I think a lot of work is happening, and it will really happen. So I think we are in the early stages, and we will definitely, as the advent of AI coming into the industry, it's going to be very, very useful in improving the outcome, improving the diagnosis, etc. But let me tell you, human judgment will continue to remain very essential in this, industry, and in clinical context, in ethical oversight and complex interpretations. Human intelligence continue to be very, very important in this industry.
Just a corollary to that question, Mr. Surendran, I think we have also had talks about, artificial intelligence sort of replacing the doctors or the clinicians in this entire process of healthcare delivery. And there have been very polarizing opinions on that subject. Where do you stand on, this spectrum? Do you believe that, sort of artificial intelligence will in future, if not now, sort of have the ability to replace the clinician, or will it merely act as a assistive intelligence rather than completely replacing the clinicians?
No, I mean, we do not think that the artificial intelligence will replace the clinicians role in this whole healthcare industry. The artificial intelligence can definitely help us to interpret the data, give some trends, give us all indicators, etc. At the end of the day, you need a doctor, you need a human intelligence there to convert all that information coming out of these AI tools, and then converting that into the right treatment and also making some responsible clinical decisions. So I think AI can make the jobs easier, and it can make things faster, but I think human intelligence will continue to be very, very important.
Metropolis Healthcare recently launched its own Center of Genomics. Now, how do you see genomics changing the preventive healthcare playbook in India, especially in a market that is both cost sensitive and uneven in awareness.
Yeah, genomics is a next big thing. It's a revolution, actually. What genomics is going to do is going to help us to do early risk predictions, targeted screening and personalized preventive care across major disease areas. It's also will talk. It will also help us in understanding our inherited diseases, and even to the extent of personalized medicine, what medicine work for you and what medicine doesn't work for you. So genomics is going to have a very important role in the healthcare industry and in diagnostic more particularly. uh, but adoption must be very phased and affordable, supported by clinical training, counseling, and patient education, right? Today genomics may be something which is really making waves in the key towns, but I think everybody in the country should be getting benefit of all the work that we do on genomics, whether it's in tier 2 cities, tier 3 cities, tier 4 cities. And how do we do that? We have to make it more affordable, and we have to get the equally faster services that you get in the rest of the country. And also, when you have a genomics report, that's largely a data, right?
Hmm.
I mean, how do you support the clinician interpreting that data and helping him taking some decision with respect to the patient's healthcare journey? So I think some of things are very, very important. So what I believe is that very strong quality standards, clinical governance and ethical data handling
Hmm.
are critical for responsibly scaling up all genomics, in this industry.
Preventive care today requires continuity, but diagnostic, if we have seen, it's still largely episodic. Patients come to diagnostic only when the doctors prescribe that, okay, you have to do these kind of tests and you have to go to a diagnostic chain, you have to get yourself tested. But when we talk about preventive care, the data gaps, is something that should be eliminated completely, and that requires continuous testing, maybe annual checkups, maybe checkups every 6 months. Now, what shift in technology or the physician engagement or the patient behavior that are needed to move from, say, one-off tests to longitudinal diagnostic health journeys? And how do we also convey this to the patient that this is something that is, important for you to keep yourself healthy?
See, the good news is that the post-COVID, we are already seeing, good trends on preventive care, rather than, reactive. In the last 3, 4, 5 years, the whole preventive healthcare, as a portfolio is going for all the diagnostic
Hmm.
operators and in the healthcare operators. The reason being, first, of course, the awareness has got better, and second, the affordability as becoming important, and now people are willing to spend that money for making their healthcare detections earlier than later.
Right.
But like rightly mentioned, there are three big elements in this whole thing. One, of course, is technology. Second one is your clinician engagement, physician engagement, and third one is the patient behavior. These are three things which is important to make the preventive healthcare much bigger. Now, whenever you go and do a test, it's a standalone report is available. But how do we get your reports? Continuous your digital health records are available. So today you do test with one operator, tomorrow you do with another operator. How do you keep the records of your, because at the end of the day you are the patient and you are the customer here, and how can you keep your information at an interoperable level? How can digitally make that technology enablement is some of the things that we all should really work upon, right? So that's one important thing. Your health records are available irrespective of where you do the test at one platform. That's something which would really help this journey. And second one, like I said, is the physicians. Physicians are increasingly embedding diagnostic into
Hmm.
long-term care through preventive panels and chronic risk monitoring. Moving beyond one-time confirmation to proactive disease management. That's what clinicians are doing currently, and I think that's a very, very encouraging trends that we would actually see in this industry. Uh, Patient behavior is also clearly evolving. Like I said in the beginning, today, the patients are willing to go and do their preventive checks very frequently. Even we are seeing the young generation of people are increasingly become curious or anxious about checking their health scorecard, etc., and which is a good news, right? And uh, as an industry, we are all trying to create much bigger awareness about it, and we are educating the patients. I think as a combination of these three things, in the days to come, and we are very confident that the preventive healthcare become a very big buzzword actually.
No,
Yeah.
absolutely. And I think, as you rightly mentioned, the younger generation is more health conscious. And especially with the, rise of wearable technologies, the data regarding your health, maybe your, SpO2 or maybe your heart rate, all of these data points are easily available at your fingertips. People are more conscious about how many, steps you have done in a particular day, what is your heart rate, what are the other data points regarding your health. So all of these are easily available. But just from a patient point of view, I have also seen people who are overly conscious about their health, and maybe just with this information at their fingertips might also indulge in their own diagnosis. How do you also sort of prevent that from happening?
Yeah, I'll also start with what you mentioned as the wearables, right? So while the wearables give you indication of your
Hmm.
health scores, it's better to be tested in a laboratory than using
Correct.
only the wearables data. But yes, as a trend, it will serve the purpose. Whether it's going up, going down, you're getting better, you are stuck, etc. It's a good thing for you to do it. So very important for us to make sure that whenever you find in trends which are alarming trends happening in your scores, the best thing for you to do is go and do a proper medical checkup, health checkup, and you do a diagnosis about your blood reports or whatever. You must do that. You must completely avoid self
Hmm.
medication. The whole purpose of doing wearables and tests etc. is basically to make sure you make more appropriate and wiser clinical decisions, right? Health decisions, you are making it wisely. So you must avoid any self medications. You must avoid completely, relying on your, wearables at this point of time. But I'm sure over a period of time, the accuracy of some of these devices will start getting better. So I think a combination of using these trends and also using the laboratory services is the right way
Right.
for you to take your health journey.
Correct, correct. Thank you so much for clarifying that, because I've seen so many young people around me relying heavily on the data points that their wearables give. But I think, as you rightly mentioned, the wearable devices serve a larger purpose of just indication, but the exact test and exact data points will only come from the laboratory tests. Let's move on to the next question about care gap in India that is most visible beyond metro cities. Uh, from your vantage point, how do you see technology-enabled diagnostics realistically deliver the early detection and preventive care in tier 2 and tier 3 markets without compromising on the quality and trust? Something that Metropolis Healthcare is already focusing as part of its Metropolis 3.0. So I think you're the right person to answer this question.
One of the bigger objective of Metropolis 3.0 is to take good quality diagnostic services to, the tier 2, tier 3 towns of the country, and let everyone in the country gets the benefit of the good quality healthcare services. That's one of the objectives that we have actually started off with. And as as a process, when we did this, when we thought through this, we thought it's important for us to set up labs even in the smaller towns. In about last 3.5 years, we set up close to 80, 90 labs, in the smaller towns of this country. But these labs are relatively smaller labs,
Hmm.
what we call it as satellite. This will actually help in the form of hub and spoke model.
Yes.
The hub is the bigger lab, the reference lab available in the big
Hmm.
cities, where a lot of high-end tests have been done. But the smaller labs and the centers available in the smaller towns of the country help the customer to reach out to these places, enable them to get the first level of support, and then we collect the samples there, and it's been sent into the reference laboratory, and the systems are actually digitally connected. The test platforms are digitally connected, and hence the patient even in the smaller towns are able to get a real time basis their reports available. And also the good news is that we are seeing the specialized doctors are also now moving towards the tier 2 tier 3 towns of this country.
Hmm.
So a combination of good quality, health care diagnostic support available in these places, and the clinicians moving into the smaller towns are actually going to to bridge the gap going forward. So I'm very hopeful that the smaller towns of this country are also going to get good quality healthcare services in the days to come. And of course, for it, it's also important for them to make sure these are all of affordable services, and having highest level of quality checks and controls are available, so that at least the patient gets the best of the services even in the smaller towns of the country.
But that, Mr. Surendran, I think brings us to the question of the balance between the scale that you want to achieve, the growth you want to achieve, and the innovation. Now, diagnostics is built on trust in accuracy, ethics, and interpretation. I think we can say that for healthcare, industry as a whole. As a managing director of Metropolis Healthcare, how do you see balancing of rapid growth and innovation with the responsibility of safeguarding the clinical integrity?
See, in this industry, one thing which is non-negotiable, is the highest quality. Patient comes to a diagnostic center or to a hospital for making important decisions of his life. So some of the things which just cannot compromise is the highest standards of quality. So that's where Metropolis stand apart, right? For us, the biggest guiding principle is that the report that the customer gets at the end of the day has to be of the highest quality. And how do we do that? Of course, we talked about technology, we talked about the doctor, clinicians, interpreting it, etc. But to back with that, we have very high quality of governance. There are our labs have been accredited, right? And we ensure that all our staff has been trained and regularly trained, because in this industry you need to keep upgrading the knowledge
Yes.
of your staff on a regular basis. You make sure that your staff has been very well trained and continuously trained, and also you have very high quality of checks very regularly, keep doing, and we have a very strong internal quality control system available. So a combination of all this, the like I said, quality, training, governance, and higher standards of ethical standards when we do it, no uncompromising standards. We actually use it, to make sure that the patient gets best of services. So that in our mind, we will treat integrity as a foundation of sustainable growth in diagnostics.
That brings us to the last question of the day. And I think everybody has been looking ahead as to what awaits healthcare in the next 10 years, because this is an exciting time with respect to the technological advancements that are coming to healthcare. And eventually, the larger goal of healthcare industry is to provide a safer and accurate care for patients and sort of reduce the care delivery time for the patient. Now, looking ahead for the 10 years, what would a truly preventive and diagnostics led healthcare system in India look like? What would be Metropolis's role in that ecosystem, and what tough decisions do industry leaders need to take today to sort of get there in the next 10 years?
Yeah, the 10 years, and I'm sure this is going to be the exciting 10 years ahead, and every year in the next 10 years, you will find the healthcare system, the diagnostic industry getting better and better and better. And all the three elements in the industry, which is technology, the physicians and the patient, you will find all the three evolving,
Right.
into a much next levels, in the next 10 years to come. So like we discussed, from the beginning, the diagnostics will become a continuous early warning layer,
Hmm.
integrated into everyday healthcare. You have to keep getting your tests done, your diagnostic done on a regular basis. That has to be the first, very important layer in this whole journey. And second thing is also, we talked about it, which is a preventive screening, become very, very important, not only for the metro towns, but all across tier 2, tier 3, all the markets. The preventive screening will become, and also with the advent of genomics, you will also be able to find out a much bigger, preventive healthcare has become much bigger.
Hmm.
You will be able to identify your risk, etc. Like I said, so that's going to be the next important thing. So, to your question of what leaders, what tough decisions leaders must, ensure. Like I said, one, of course, is uncompromising quality. You have to provide the best quality of services, your reports, your diagnosis of the best quality. That's something that absolutely not compromisable. And your digital ecosystems, you need to invest in your digital ecosystem, and you have to also invest in your people, to make sure these things, some things get much better. And you need to have a continuous education of the clinicians, how the preventive health etc will really be useful, I think. And providing them with the right trend reports, right insights, help them to interpret the report
Right.
etc. That's other thing that you really need to invest. And important, the most important all is ethical governance. Now, that, going forward, data will become, very, very important. And unless until you play with the data, use the data ethically, it's going to be, little worrisome. So I think quality, investment in digital system, investment in people, high levels of governance, and also the ethical integrity. These are some of the things which the leaders must not compromise, and have to take tough decisions around these areas, if you ask me.
Well, thank you so much, sir. Thank you so much for all those insights. One of the takeaway that I have from this conversation of ours is that diagnostics is no longer just a supporting function, but it is first line of defense in the care delivery from now on. Especially post COVID, that has been true, but in the next 10 years, it will be the first line of defense, and people would soon realize that for continuous care delivery, they need to have their healthcare data at their fingertips, and that's the evolution that we will see in the next 10 years. And I think Metropolis Healthcare is at the forefront of sort of leading that transformation. So thank you so much for this conversation, and all the best for this journey. Really lovely talking to you about Metropolis 3.0 and the Center of Genomics as well. Thank you so much for this conversation.
My pleasure, Aarti. And I just wanted to conclude by saying that in the healthcare ecosystem, it's not only the hospitals
Yes.
which will play an important role in the coming days, but the diagnostic setup will also play a very important role, equally important role, if not more, in the whole healthcare ecosystem. That's something that I just want to leave the message with.
Absolutely. Well, with that, we have come to the end of the episode, and I believe all of the audience at DHN would really love this episode, and will have important insights to take away from this conversation. Thank you so much, sir, for joining us today.
Thank you very much.